Good evening. Welcome to show episode 3, The Game Perfection. Bets on the table about luxury and expenditure on the case square. 2 bets on the table. Let's start. With us in this episode 3, Hanan Alpha, Hanani Act, Hanani Moon, Arti Hanan. Welcome, doctors. Arti Hanan throwing dice. He got the 2 bets on the table and moved to satisfy square. The effects of severe systemic overdosage of older agents of H1 antagonists resemble those of atropine overdosage and are treated in the same way. I said before that satisfy is the square for something to worry about or to mask your real interest when you deal with patients, and to remember, but not like prompting, to just remember it to satisfy. 1 bet for Arti Hanan at satisfy square. Hanani Moon throwing dice. 1 behavioral, 1 at student on the watch. Hanani Moon playing on the watch. Student minute. They drawing the 2 arrow referring to student minute with the subject dosing diazepam as a skeletal muscle relaxant. Dosage is begun at 4 mg per day and gradually increased to maximum of 60 mg per day. Diazepam has useful antispastic activity. It apparently acts at all GABA synapses. Deep bet and very elegant from Hanani Moon, from their castles. Thank you, and congratulations, and celebrate your pets. Congratulations for your pet. Hanani Act throwing dice. 3 behavioral. Behavioral is like talking to medicine or other college. Environment square. The subject H1 antagonist. H1 antagonist is contraindicated while driving. For those H1 antagonists that cause significant sedation, addition of other drugs that cause CNS depression produce additive effects. However, sedation and interference with safe operation of machinery, which occur in about 50% of subjects taking antihistaminic, occurred in only 7% of subjects taking terfenadine or estimazole. Precious caution, and 1 bet for Hanani Act at Environment Square. Again on the watch, Hanan Alpha throwing dice. 3 behavioral to the read minute. To read about pharmacokinetics, title maintenance dose. In most clinical situations, drugs are administered in such a way as to maintain a steady state of drug in the body, i.e. just enough drug is given in each dose to replace the drug eliminated since the preceding dose. dose. Bravo, Hanan Alpha, about maintenance dies. On the other side, the drug dosage regimen. Drug dosage regimen, thus calculation of the appropriate maintenance dose is a primary goal. Clearance is the most important pharmacokinetic term to be considering in defining a rational steady-state drug dosage regimen. 1 bit at read minute for Hanan Alpha. RT Hanan throwing dice. Five. Was oral to the prompting square. Subject propensity, a tendency to behave in certain ways. Prompting here with the mean of scene indicating readiness. He translates prompting at this bit as scene indicating readiness. The prompting bit, the propensity of drugs to bind to different classes of receptor sites is not only potentially vexing problem in treating patients, it also presents a continuing challenge to pharmacology and opportunity for developing new and more useful drugs. It is likely that some of these drugs will eventually be shown to act via receptors for endogenous agonists, as in the case of morphine. Morphine has shown to act on receptors physiologically stimulated by the opioid peptides. Several subclasses of opioid receptors have now defined in a fashion reminiscent of earlier studies of autonomic receptors. Morphine is a potent analgesic agent. He mentions that bit could fit also at reading minute. 1 point for that bit to Artiana. Hananylot throwing dice. 1 again on the word. To the presentation square. Elegant bit. It is advertisement about watch, and the woman stand on a frame. They mentioned that the minute could fit at frame minute, but it could also fit at presentation minute. The bit for prazosin, and on the left of the picture they wrote, if anything even better, as that woman saying that, for prazosin drug. On the other side they refer to their core in pharmacology, stay tau to vision. Tau is like the vehicle زي الونش كده. stay tau to vision. Brand communication. Hananylot said that it's brand loyalty. Very good presentation, and 1 point for that bit. Hananylot strong dice. 5 and gain tour. Congratulations to the luxury square. Let's see what he got. 1, 2, 3, 4, 5, 6 bits. and he will put his bet at Locketree Square. The subject, brand loyalty toward fans. He wants to remind himself to be the star for his fan, as he respecting his career very much. He wrote address on YouTube channel Hugo Boss. The title, Create Your Look. Hugo Boss suit, create your look, one concept, different styles, various options. Let's see his luxurious interest on Hugo Boss channel. Artie Hanan throwing dice. Game. Congratulations. 5 and move to the teaming minute. He also wrote a web address www.pharmacyrestaurant.com. The pharmacy named PH2. The title, Interesting Teaming. This pharmacy made a restaurant, as you see in the picture, and decorated with capsules, tablets, and there are tables and chairs and dishes. The menus, they have menus, brunch, starters, mains, desserts, حلويات يعني. What a pharmacy team. Good choice at teaming minute. And celebrate your gain 1 bet about Locketree and 1 point for the bet at teaming minute. After hands one guy. Two and gain, congratulations. He got the 1 bet about teaming and moved to the 4th square. He bought advertisement from Simons.com. On the picture, she is ready to take center stage. Are you? The address is www.simons.com/artisthegood-club. For you, though it takes more than stretching your body, you need to stretch your capabilities with a solution that will enable you to see more faster in your interventional suit. System can rotate 360 degrees in 6 seconds. The title, Simons, use Senro Dyna-Act 360 with your art is Zigo, and you can acquire large organ soft tissue images faster than with any previous Senro Dyna-Act application. The subject, answers for life. On the bit also that can fit on intervention minute, but here at the 4th square by Artie Hanan. 1 point for that bet and fit also. Hananylot throwing dice, also 1 to the reading square, the reading minute. Subject is 0 efficacy. The drawing 0 with some components circle around the 0 and throw the 0. A drug may have 0 efficacy, i.e. may be pure antagonist or any degree of efficacy greater than 0. partial agonists can be viewed as drugs with such low efficacy that even occupancy of the full complement of receptors does not result in the maximal response that can be elicited by other drug full agonists. To express the idea, pharmacologists refer to the efficacy of a drug as a way of indicating the relation between occupancy of receptor sites and the pharmacologic response. The reader will see that many drugs used as competitive antagonists are in fact weak partial agonists. One point for the beta treatment. Hananylot strong guys. To the described square. It is some cultural bit about liver biopsy. It is clear that non-invasive method cannot distinguish NASH from NAFLD. Liver biopsy remains the gold standard for grading and staging, i.e. recognition of inflammation and fibrosis in this setting. On the other side, non-alcoholic fatty liver disease. Non-contrast CT scan appears to be useful for detecting steatosis. Non-alcoholic fatty liver disease is a translation for that abbreviation NAFLD. Non-alcoholic fatty liver disease is a spectrum of disorder ranging from steatosis to non-alcoholic steatohepatitis, NASH. The pathogenesis of NASH obesity represents a low-grade systemic inflammation, and NASH is part of this generalized pro-inflammatory state. Active reading from Hananylot, and 1 point for that. Hanan Alpha throwing guys. 1 brand going to the reference minute. Elegant pet with like lamp from component of the life activities about resistance. Our choices. Resistance. The subject definitions in reference is reference mean here definitions. Resistance is determined by intrinsic factors including metabolic products and autonomic activity, by various pharmacologic agents, and by the extravascular mechanical compression of coronary arteries. The site of regulation appear to be the arteriolar resistance vessels. Precious bit from Hanan Alpha, 1 point for that bit at reference minute. RT Hanan throwing dice. Congratulations. We'll gain these 4 bits. More 4 bits for RT Hanan. To the technique square. The bit about glucagon. Glucagon, its half-life in plasma is between 3 and 6 minutes. Glucagon aid in X-ray. Glucagon has been used extensively in radiology as an aid to X-ray visualization of the bowel because of its ability to relax the intestine. He mentions that the bit also fit at the radiology minute, but here at the tech square. choose to play on the island. Honeymoon throwing dice. 1 to the right minute. Taking 1 bet at the technique on the island. And at the right minute they will input handmade novel Sword and Armor about القدرة على وجود الفاعلية about opioid drug novel drug in Arabic. Celebrate and celebration with your castle's production as novel drugs at right minute. 1 bet. 1 bet. Hanani acts wrong die. 6 and gain. Moving to a act and elegant bet at apply square. The subject choice of a beta blocking drug. And the drawing of a fashionable dress designed as component squares and some compartment of pictures of flower plants entitled as choice. On the other side all application, the letter of the word application. He wrote propranolol is a standard against which newer beta antagonists developed for systemic use should be compared. Again, propranolol is a standard against which newer beta antagonists developed for systemic use should be compared. In many years for very wide use, it has been found to be safe and effective drug for many indications. Elegant bet and celebrate your gain. It's a novel drug and 1 point for that bet. Hanan Alpha throwing dice. 3 behavioral to the minute satisfy content. Wow, what a precious bet. The subject, no sentence. Drugs saying no, like timolol, guanicidine, propranolol, hydralazine, diazoxide, digoxin, amrinone, minoxidil. On the other side, I'll read line by line. Timolol with no local anesthetic activity. It has excellent ocular hypotensive activity. Guanicidine inhibits the release of norepinephrine from sympathetic nerve endings. Propranolol has no detectable partial agonist at beta receptors. Hydralazine dilate arteriole but not vein. Diazoxide prevent vascular smooth muscle contraction by opening potassium channels and stabilizing membrane potential at resting level. Stabilizing membrane potential at resting level. Diazoxide. Next one, digoxin inhibits sodium potassium ATPase, the membrane bound transporter often called sodium pump. Amrinone increase myocardial contractility without inhibiting sodium potassium ATPase activating receptor. Minoxidil Dilate arteriole but not vein. Used in patients with renal failure and severe hypertension. No sentence by Hanan Alpha at satisfy content. 1 point for that pet. And the winner is Arti Hanan, 11 bits, Hanani Act, 12 bits, Hanan Alpha, 5 bits, and Hanani Moon, 5 bits. Celebration, and the winner is Hanani Act, medical and pharmaceutical seniority. Hanani Act. The final game for that season will be next episode between the three seniorities. And again, congratulations to Hanani Act and celebrate your game. And we are waiting for your using gains on the final game. The three seniorities played on the island, and the final game will be only on the island. There will not be watch dices. Celebration, seniority, medical and pharmaceutical seniority, Hanani Acts. Next episode they will play only with their game. As gained or as extinguished. To the next episode. The best will go on with you.